I'm Mrs. Princey, Associate Professor in Mental Health Nursing. There was a woman who was 34 years old who had a history of a mother who was suffering with depression and brother with panic anxiety. This woman had completed her post graduation and started working. Later on, she got married and she gave birth to a healthy child. After the birth of the child, most of the time, the woman felt excessively physically exhausted and had an increased need for sleep. She felt incapable of looking after her child, and most of the time, she depended on some other person for giving a care to the child. So, looking into this condition, she felt herself, very guilty and started to have an intense worry about herself and her future. She repeatedly compared a situation to her past, right? So, how was she before and how is she now? What are the changes that she had that she tried to compare? And every time she tried to compare, she became more and more anxious and more stressed out. She was dominated by severe anxiety, felt the feelings of helplessness, hopelessness, and she always required a reassurance from the other person. When she was taken for a psychiatric investigation and examination, she was found to have a disorder called as severe adjustment disorder. Each and every person as a human being has to cross the various developmental stages. So each and every developmental changes or the transition which happens at each and every stage of development may require some kind of adaptation. Some of us may easily get adapted to the transition, and some may feel it very difficult to get adapted or to get adjusted to the transition. So today I'm going to discuss about a very important topic which is related to the stress related disorder, which is called as the adjustment disorder. In the previous videos, I have explained about the disorder known as reaction to stress, right? So in the reaction to stress, we have got mainly the two disorders. One is the acute stress reaction disorder and second one is the post-traumatic stress disorder. Along with this, another disorder which is related to stress is the adjustment disorder. So let us see the adjustment disorder. Before going to the topic, we need to know what is the meaning of adjustment. Adjustment is the process of modifying one's behavior in the changed circumstances or an altered environment to fulfill the needs of the person. So the needs of the person can be the psychological need, social need, or the physiological needs. That is called as the adjustment. Moving on to the adjustment disorder. Now, what do you understand by adjustment disorder? It is a state of subjective distress and emotional disturbance, usually interfering with social functioning and performance, and arises in the period of adaptation to a significant life change or to the consequence of a stressful life event. So you can say as an adjustment disorder is an inability of a person to cope up with the transition or to cope up with the changing circumstances, which can lead to a disturbance in the emotion and the overall performance of the person. So that is called as the adjustment disorder. Moving on to the classification of adjustment disorder, the ICD-10 classification, we have got the chapter F43, which describes about this adjustment disorder. So F43.0 describes about the brief depressive reaction, F43.21 prolonged depression reaction, F43.22 mixed depression and anxiety reaction, F43.23 predominant disturbance of other emotions, F43.24 predominant disturbance of conduct, F43.25 predominant mixed disturbance of emotions and conduct, F43.28 which is the other specified predominant symptoms, right? So this is the classification, or we can say the ICD-10 classification of the adjustment disorder. Moving on to the etiology, or what is the reason, predisposing factor for an adjustment disorder. Mainly, we have got the three factors. One is the biological theory, we have got the psychosocial or the psychodynamic theory, and third one is the transition stress model or adaptation model. The first one, which is the biological theory, is going to explain about the biological factors contributing to the adjustment disorder. Maybe it can be the mental retardation, certain kind of the organic mental disorders like delirium, dementia, or amnesic disorder, or it can be a genetic predisposition. Okay, there is a family history, especially the first degree relatives who are affected with any kind of the anxiety disorder in the family can contribute for the other members also to develop this anxiety or adjustment disorder, right? So if you take the psychosocial theory, it explains about the early childhood exposure to trauma. So during the earlier stage of the childhood development, if the child was exposed to any kind of the trauma, or if the child was reared in the family where there was increased dependence, that is, the parents don't give freedom or independence for the child to carry out some kind of the activities that they can manage to some extent. Okay, they have been reared in such a family that they are become so much dependent for each and everything, right? So that kind of a family can contribute for a child to develop this increased dependency, right? So in those situations, later on, such a kind of a child can end up with the difficulty to adjust in various situations in their life, leading to the adjustment disorder. The next one is a retarded ego development. So again, this is during the earlier period of the childhood. If the child was not able to develop the adequate ego system, right? So he was not able to face the various situations and try to cope up with the defense mechanism, techniques. Then he may have a very poor or a weak ego, which can lead him to the stress when he faces a new situation. So, retarded ego development during the earlier stage of development, later such a kind of a person can end up with the adjustment or the stress related disorder. The next factor is the stress theory or the transaction stress model or the adaptation model. It explains about mainly two factors. One is the situational factor and the interpersonal factor. So what is this situational factor? As the name says, it is based upon the situation of the person. Say, for example, he is having an unstable economic condition. Okay, so unstable economic condition, maybe it is a poverty, or he may have a lack of occupation or recreational opportunities. Okay, so those kind of things which can cause a person to become stressful can lead to the adjustment disorder. Imagine a person not having an occupation. He's tried many times to get a job, but still he ended up with no job, leading to stress and anxiety, right? So if the particular family is lacking the recreational opportunity, right? So each and every family have got their own recreational activities or recreational opportunities which has been given to their child. So when child has been reared in such a kind of family where there is no recreational opportunity for the child, which is actually going to help out the child to let out all his emotions through recreational activity. So such a kind of child who is lacking the recreational opportunity later on, when he faces various kind of situations, can feel very much stressed out to face those situations, can lead to the adjustment disorder. The next one is the lack of social, religious, as well as the cultural groups, which is actually termed as the support group. If the person or the child is lacking the social support, or the religious and cultural support is lacking in the particular person, okay, then he can end up with the stress related disorder. So this is the situational factors which can contribute to the adjustment disorder. The next is the interpersonal factor. So interpersonal is present within the person himself. So what are those factors? It is the inadequate coping skills as well as the social skills. So if the person is such a kind of a personality who doesn't socialize with others. Okay, there's an inadequate social skill which is there in a person, or if he is not using the adequate coping mechanism when he crosses this stressful life situation. So, such a personality can end up with the stress related disorder. Another factor is the presence of psychiatric illness. So, what is this presence of psychiatric illness? Okay, already there is a kind of a psychiatric illness present in a person, coupled with the stress, can contribute to a major, again, a severe form of the disorder. So, already a person is having a psychiatric illness. It can be any kind of a psychiatric illness. When he is exposed to a stressful situation, is having an inadequate coping mechanism, can contribute to the anxiety disorders as well. So these are the various predisposing factors which are contributing to the adjustment disorder. Moving on to the clinical features of adjustment disorder, as I told you, the main reason is here because of the stress or the stressor. It doesn't mean that, when the person is exposed to the stressor, immediately he will end up with the adjustment disorder or anxiety disorder. No. Continuous exposure to these stressors or the stressful situation can result in the development of these symptoms in an insidious manner. Onset of this adjustment disorder is usually happening within a month of exposure to any kind of a stressful situation or a stressful event. So you can imagine, if a person is continuously exposed to a stressful situation for at least a period of 1 month, then after a month he may start showing the symptoms of anxiety or the adjustment disorder. And also another important thing is the symptoms doesn't always subside as soon as the stressor is being ceased. That means if you remove the stressor, okay, it doesn't mean that the symptoms of adjustment disorder will immediately subside. No. Okay, even though you remove the stressor, the causative factor which is contributing to the adjustment disorder, it takes time for a person for the symptoms to come down. Immediately it will not, he will not revert back to the normal. And this kind of a disorder, the adjustment disorder, has not got any specificity that, in this particular age group itself it will affect. It can affect any age group, because transition keeps on happening throughout the life of the person. Each and every stage there is a transition. So any age group can get a problem with the adjustment disorder, can develop the adjustment disorder. So it is not specific to a particular age group. And if the person is continuously exposed to a stressful environmental situation, it can end up with the chronic adjustment disorder or chronic anxiety disorders. Now, what are the manifestations the person will experience? Number one is the depressed mood, anxiety, worry, a feeling of inability to cope and also to plan ahead for the future. The stress and anxiety even continues to the present situation. So you can imagine a person had the stress since 2 weeks, but even the present situation, the person will be disturbed. Okay, so it keeps on contributing even to the present situation wherein he cannot concentrate on any of his activities because of the stress and anxiety. He may also exhibit the assaultive behavior, reckless driving. So all these behaviors are nothing but the negative coping mechanism. So he is not able to cope up with the stress. So he may at times become very aggressive, or he may show anger resulting in the assaultive behavior or reckless driving behavior that he may have. He may also have the behavior of defaulting in the legal responsibilities and withdrawal. Okay, so these are certain manifestations that you can note in the adjustment disorder. Moving on to the diagnosis, how can you diagnose the disorder? The first and foremost thing is you're going to talk to the client, get the history, do the assessment. Right? So you're going to collect the history of the personality before the adjustment disorder. How was the personality of the person? Was there any psychodynamic factor which is contributing? You're going to find the cause. You're going to find that what is the situation which is causing him, stress. So you're going to rule out what is the history of the client. You're going to do a mental status examination, especially when it comes to the thought. You're going to assess the form of thought, the content of thought, and the severity of symptoms. And you're going to in-depth collect the information related to the stressful event that he had experienced recently, or any kind of the crisis situation he had, underwent. So, what were the coping mechanisms that he tried to cope up with, right? So, all this information that you're going to collect, and based on this, you're going to do the diagnosis. Moving on to the treatment. So, what is the treatment for this adjustment disorder? Since the patient shows the symptoms of depression, anxiety, okay, so you may have to put the patient on certain medications, psychopharmacological agents, which is the antidepressant group of drugs, anti-anxiety drugs, as well as the benzodiazepine group of drugs. Apart from the pharmacotherapy, you have got the various psychotherapies. The first thing we have is the individual psychotherapy. So, individual psychotherapy, you're giving a counseling, one-to-one counseling. So, you're going to rule out what are the causes. You're going to sit as a psychotherapist. You're going to be with a client and teach him various techniques to overcome the stressful situations, and give them the suggestions to come out of it. The next is the family therapy. So, if the reason is the family, if the client is not having the adequate family support system, or the family dynamics is not appropriate or proper, or the parental overprotection, or which can lead to the increased dependency, so even the family have to be given the treatment. So such a kind of the family wherein the cause is the family itself, then we will be undergoing the family therapy for the client. The next one is the behavioral therapy. So in the behavioral therapy, you're going to bring about the modifications in the behavior, especially the cognitive behavior therapy. You're going to bring about a change in the cognition as well as the behavior of the client, since the patient may have negative cognitions, negative thoughts, pessimistic thinking, feeling of guilt, hopelessness. Okay, so all such feelings that he may have, which may have to be modified through the behavior therapy techniques. We also have the self-help groups. So what is the self-help groups? Just like the Alcohol Anonymous group, we have got the self-help group wherein the patients who are experiencing the adjustment disorders and who have already overcome, okay, patients will be grouped, and even the client will be put in the group as being a part of the group, wherein he will learn, he will get the ideas from the other patients who are real life witness, that how they overcame the adjustment disorder, what are the strategies that they followed, or what are the techniques that they followed. So all those things that you're going to help out the client with, right? So that is the self-help group. The next is a crisis intervention. If the client had recently experienced any kind of a crisis situation which is contributing to the symptoms of feeling of helplessness, hopelessness, a lot of stress and suicidal ideas or depression, you're going to make the client, or any kind of the assault or trauma that the patient had underwent. So such a client requires the crisis intervention, so you will be planning for the same. Okay, so these are some of the treatment options which are available for the client. Right? So what is the nursing management? As nurses, what is your responsibility is you're going to do the assessment, you're going to collect the information, do the metastatus examination, find out the signs and symptoms, and also give them the intervention based on the symptoms, right? So you especially teach them the various relaxation therapy techniques which is really going to help out the patients. It can be yoga, meditation, or listening to the music, or involving themselves in the breathing exercises, the various kind of aerobic exercises. Okay, so all those relaxation techniques which you're going to educate the client that he has to practice and change his lifestyle, very, very important. Apart from that, you're going to assist the client and the psychotherapist in various form of the psychotherapist. Be with the client, give the education to the family as well as the client about the drug therapy as well as the follow-up visits. Okay, so this is about the adjustment disorder, the inability of a person to adjust to the change in the situations. It can lead to the emotional disturbance, physiological disturbance, as well as the social disturbance. Hope you all have understood the topic. Thank you.